Welcome to People, Places, and Parables, highlighting people and the positive effect they have in our community.
Hello, everybody. This is Christopher Olson with People, Places, and Parables. And like I like to say, be positive is my blood type, and be positive is my motto. I am ecstatic today. Jason Parent with the Aroostook County Action Program. For those of you who don't know, Washington County and Hancock County, their action programs were struggling, and the deal was worked out so that Aroostook County now covers Washington and Hancock as well. Welcome, Jason. Thank you for being here today.
Chris, great to be with you. And now you have four P's today. You have your title with parent. So I'm happy to
Yes.
be here with you.
So, first question off the top of my head for you is, how long have you been with ACAP?
So I'm going into my 11th year with the agency. I came into Community Action Agency and into this Community Action Agency in October of 2011. And so this is my coming on my 11th anniversary.
That's wonderful. As the same year that we started Welcome to Housing, and I'm so glad because before the announcement was made, I had been in touch with people in Hancock and Washington counties. We have no geographic restrictions, so I was really excited. And one of the things that I would love to share with you, if you're not familiar with it, and the viewers out there, there's a thing called Penobscot County Cares. It's started by Doug Dunbar. It came about when the ARPA grants, the American Rescue Plan Act, came about. And what it does is it ties in any and all agencies and people from outside of the area. And one of the things that I would like to work with you on, if it hasn't been set up already, is doing something similar. If we could find somebody willing to facilitate. They actually meet every other Thursday. They're meeting later this afternoon. But it's nice because there are so many good organizations out there, small ones, and that's one of the reasons I started the podcast. So how has it been from going from the county to all of a sudden you've got Washington County, which has a whole set of issues on its own, and Hancock County?
Well, it's been overall a very positive transition. It's been a lot of work. I'm not going to shy away from saying that. But people have been very welcoming and embracing of our work and our efforts to try to bring together the three counties and to first and foremost ensure that the programs and services that Community Action was offering in Washington and Hancock counties continued and continued uninterrupted. And I will say that from that perspective, we have been successful in ensuring that that happened. Now, I say that the one area of services that we did not move into our community action agency is transportation, as we had done some learning about the fact that really that basket of program had already moved on to other organizations who had begun to offer it. So, unfortunately, we are not the transportation provider in Washington and Hancock counties, but other competent providers have picked up that service.
That's excellent because I know that's one of the challenges working at the American Cancer Society years ago. The Road to Recovery, getting somebody from Millinocket down to Bangor was actually a piece of cake. Getting somebody from one side of Bangor over to the hospital was not. It's because it's volunteer driven. And if you could give me a little bit of a background, so many people that are probably watching this are in my area that work with Penquist. How is the funding and so forth? Is it federal? Is it state? Is it county, municipal? What are some of the ways that you get support to keep up and running?
So we are funded through a number of federal and state contracts, the Home Energy Assistance Program and the Weatherization and the Home Repair Program, and those all come through funding sources from the federal government with some minor funding from the state. And then, of course, we have the federal Head Start program that comes through the federal government as well. We're a community services block grant organization, so that's what makes a community action agency a community action agency. So we're officially designated by the federal government and by the state of Maine as it passes through the state of Maine through the Department of Health and Human Services. And then there's a wide variety of other funding sources. We do receive some private funding sources. We receive appropriations from municipalities across the three counties. I've been spending a considerable amount of time in town meetings in Washington and Hancock County in particular, sharing with residents in whether it's a budget meeting, a town council or a select board meeting, or in the case of this past Monday, I was in Surrey in a full-on town meeting with the residents of the community, and I attend those to share information and to build confidence in the community action movement and to ensure community members that their community action agency is in fact there for them. But those critical dollars that we receive from local municipalities are really match funds that we use to bring in those federal and state dollars to support the programs that are supporting the most vulnerable residents of their community. So it's a wide array of funding sources, mostly through grants and contracts that we are able to administer for the people of the three counties, and they look different. So in Aroostook County, we provide the Women, Infant, and Children's services. That's a different provider in Washington and Hancock counties. We also provide the basket of prevention services, so substance use prevention, tobacco cessation and prevention, and the healthy eating active living program. We provide those in Aroostook County. Those are Healthy Acadia's programs in Down East. So partnerships are critical in the work that we do because we do practice what we call a whole family or comprehensive service delivery approach, where we really assess the needs of the entirety of the household and connect to services, whether they're behavioral health, traditional health care, or other services that aren't necessarily under our purview, but are needed by the consumers that we work with.
That's excellent. I know, for instance, Maureen Bean started the Burlington Food Pantry, and a while back we had some furniture. A gentleman had passed away that we had helped, and rather than haul the furniture back to Old Town, we were looking for a local source, and I'd been in touch with Maureen a few years back, and they started the food pantry. And one thing I didn't realize that they, even though they're in Northern Penobscot, they help people in Danforth. So that's fantastic. It's amazing the collaboration to see with nonprofits. Actually, two of the organizations I deal with in the county are the Aroostook Veterans Alliance, and they're apparently I talked to with Jim Gehring, and they've come into some money. They have a warehouse. They do something similar to Welcome to Housing, and despite the name, they help everybody now. That was kind of my hope that would happen. There's also a furniture bank called County Cares, and we've been trying to get in touch with them. But if there's any possibility of setting something up to maybe once a month or something to have a Zoom sort of meeting to let people know what's out there and they can work collaboratively, that would be great.
Yeah, I think one of the resources that we connect with on a regular basis is called the Aroostook Community Collaborative, and it's loosely based after the Caring Community Collaborative in Washington County. So we actually, as part of our community services block grant, provide the backbone support services for the Aroostook Community Collaborative. The executive assistant here at the agency takes all of their minutes, calls the meetings, and gets the meeting notices out, and we facilitate the Zoom link. It used to be an in-person meeting. It's now all held remotely for those meetings. And they are the body that nominates our consumer sector members to our board of directors. So when we were looking at our expansion in Washington and Hancock County, we looked for parallel organizations to the Aroostook Community Collaborative. Not a difficult question at all in Washington County, where the Caring Community Collaborative actually was a loosely based forerunner of the Aroostook Community Collaborative. Was more of a challenge, ironically, just as a matter of fact, in Hancock County, we could not find an organization similarly that brought other organizations together on a regular basis and sort of served in that capacity. So Healthy Acadia in Hancock County is the entity that nominates our consumer sector members to the board. But yes, so there we do connect on a regular basis with those collaboratives.
That's wonderful. Excellent. One of the people that I'd been speaking with originally before I knew some of these things existed is actually one of the people I just interviewed, Sarah Bowden. She took over what's called the Community Closet. It's now Community Closet 207. I learned from the interview that we did that it goes way back to a church that had a room where they were stockpiling things for people, and they do a lot of work with with young mothers to get baby formula diapers and so forth. And it's interesting because I know that the food stamp program, which is the EBT now, we learned a few years ago you cannot, if you're starting over, you cannot use that for feminine hygiene products. You cannot use that for, say, toilet paper and so forth. So we used to do drives like that. What are some of the challenges? I know it's fairly fresh where you've started with these two communities. I believe it was last October?
Last October is when all of the contracts and for programs and services, we actually started collaboratively with them in January of 2025 when we started to share our chief financial officer. And in February, we were asked to share our early care and education leadership team. And so we started that, and then by July 1st, things had really changed for the worse, unfortunately. And so the Head Start program transitioned to us. And then between August was the energy assistance and weatherization program. And by October, the elder care services or aging services programs moved over, and that was the last. So by October 15th, all the programs had officially moved under our umbrella. And we've been working with community members down there for, like I said, over a year now.
That is absolutely fabulous. When I look at you and hear how many connections there are, I think of the guy at the circus that has all the plates balancing on the skinny dowels. What are some of the challenges that you see down the road? I know, and it's a stereotype, but I know that Washington County, for example, there's been a lot of issues with overdoses. There's been a lot of issues with drug trafficking and so forth. Are you finding a lot of people coming forward and saying, what can we do in our community?
Yeah, absolutely. So as a community action agency, we're required federally through our community services block grant to do a comprehensive community needs assessment every 3 years. So the most recent one just came out in 2025. And what we've done over in recent years, back in 2021, the previous assessment, when that was underway, we actually coalesced all the community action agencies in the state to go on the same cycle, because DCP used to be on a different cycle than ACAP. And so you'd have all these needs assessments in 3-year intervals just happening and popping up across the state. So we first, in 2021, aligned all the community needs assessments together so that we'd have a patchwork quilt that would show a picture comprehensively of the entire state. Then between 2021 and 2024, the next time that one went out, we actually aligned ourselves with the healthcare systems in the state of Maine that do what's called the China report, the community health needs assessment, because they're on a 3-year cycle as well, and they were now on the same 3-year cycle. So we brought all of those initiatives together and did a very comprehensive assessment of needs that factored in healthcare and social determinants of health. And so we're working right now to develop a strategic plan for the next 3 to 5 years for the 3 counties, working off of the strategic needs or the needs assessments for Aroostook, Washington, and Hancock counties. And we've done a crosswalk of those needs assessments to be able to say, where are we similar, where are we different, and who are we partnering with to strategize around that. So yes, drug use is one of the challenges that is shared across all 3 counties: transportation, housing, those things that we all hear about. Things that didn't appear on that, but that we know both anecdotally and statistically are childcare didn't appear in the top 5 in the counties, but we know that that's an issue, and it's one that we're working on each and every day. So we take some liberty and some license because of just what we know that maybe the people participating in the survey didn't have young children or didn't have that as a concern, but it is a concern, right? So we're working on those things, and it's how we address those things sometimes that look a bit different. So for example, transportation, now that's not part of the basket of programs, and it never was in Aroostook County part of our community action basket of programs, and there just isn't enough money to solve the transportation challenges of our region. We decided that instead of bringing Muhammad to the mountain, we were going to bring the mountain to Muhammad, if you will. And we worked with Senator Collins to apply for congressionally directed spending to establish a mobile service unit. And we took this, we were able to purchase this large RV and have it transformed into 2 office spaces so that we can take our services on the road to communities where we don't have an office, where people can't naturally come to us with ease or facilitation. And that happened as a result of lessons learned during the pandemic, when we experienced a high rate of people actually showing up for their appointments because they were all over the phone. Transportation wasn't a barrier. So we interviewed and we did a survey of our customers, and our customers told us overwhelmingly the reason why I made my appointment and didn't have trouble is I didn't have to rely on my son or daughter to come give me a ride, or I didn't have to borrow a neighbor's car or whatever. It worked for me. I just had to be at the other end of my phone. But what we weren't able to do is lay eyes on folks, because when we have individuals who come into us for services like the Home Energy Assistance Program or others, we can pick up on other vulnerabilities, on food insecurity, on really horrific things like elder abuse or domestic violence and things like that. And we're able to help people in a more robust way. So just transitioning our services to all phone was not advisable. And for some program like the Women, Infant, and Children's program, you can't do a child's biometric screening over the phone. So we had to come back to some format of in-person services, but we wanted to be closer to the people. So we launched it last May, and it went throughout Aroostook County. I think it had 56 working days that we were doing appointments in it, and we were able to increase our connection with people. And this year we're working on a schedule that's going to bring it into Washington and into Hancock counties, into those rural communities where people might not otherwise be able to access services. So
That's fantastic.
yeah.
That's fantastic. One of the wonderful resources we have here in the state of Maine, and I've discovered with our program because we're one town over from the University of Maine, is the University of Maine system. We have a gentleman that's been very supportive of us from the get-go. His son has been a volunteer with us off and on over the years. He actually teaches social workers at the University of Maine Augusta Bangor campus. Have you folks had a connection with the University of Maine Machias and so forth? I mean, because to me, when you think about some of the university and college students looking for real world experience, my God, for organizations like ours, you can't beat it because they want to learn. They'd much rather learn from doing rather than, a rhetorical.
Yeah, our connections with both the University of Maine system and the Maine Community College system run deep, and they did prior to my coming to the agency. In the interest of full disclosure, I worked for both of the University of Maine and Maine Community College systems at campuses here in Aroostook County, both the University of Maine at Fort Kent and Northern Maine Community College as the Chief Communications and Development Officer. So let me just go over with you how those connections run deep. I mean, for years, our childcare center was located or co-located right near the University of Maine at Fort Kent Center in Fort Kent. We've had board members on the public sector, the private sector, representing the education sector from both UMFK and UMPI in the past here in Aroostook County. We are on the precipice of about to open up, as soon as we receive childcare licensing and fire marshal approval, a childcare center on the campus of Northern Maine Community College. We have deep ties. I'm an alum of the University of Maine at Presque Isle. We've had a child care center on their campus in the past, and we have deep partnerships there from a program level. They send students here in the social work program as interns and the like, and we work very closely with them. And in Washington County, those roots run especially deep. We have child care centers both on the Washington County Community College campus and the Flaherty Center on the University of Maine at Machias campus. And the dean at the University of Maine at Machias, the president at Washington County Community College, and the president of the University of Maine at Presque Isle all participated in our visioning sessions that when we brought leaders from the three counties together. And then the president of the University of Maine at Presque Isle was one of the participants in our sessions that our marketing and branding firm that's helping us to uncover a new name that he provided feedback in that. So the linkages are real and they are deep. And then the other thing I will say is that a few years ago, or like 5 years ago, when we were really transitioning into the whole family approach, the University of Maine system, through the chancellor's office, loaned us. They have a person on staff that's a matrix organization expert that's helped them to essentially rebuild their system and take it away from some of these backroom operations that are individually housed on each campus, and really to have a coordinated finance team and have a coordinated financial aid team and all of those back office services that really don't impact how student services are delivered on the campus. They gave us their matrix organization expert as a loaned executive to work with our organization to be able to help our staff understand how we function as a matrix organization, which really takes people away from the traditional vertical integration in an organization where you only report up to your leader.
Hmm.
We have work teams in our organization that are cross-functional, that work across programs to help take down some of those silos, because the way we're able to serve our customers is dependent on us essentially breaking the mold and the model that these government programs would otherwise have us solely operate under. It doesn't work for us to have, and I did this in the first 3 months that I was the CEO of Aroostook County Action Program. I spent those first 3 months in my calendar specifically dedicating time to being with staff and shadowing staff. I was in classrooms having family style dining lunches with students. I rode the Head Start bus to and from to be able to see how that process went. I went with our weatherization team into homes where they were doing work, and sat in WIC appointments, and really every aspect of the organization to see it through the eyes of both the customers and the team members. And it was when I was sitting in a home energy assistance program appointment that something profoundly really revealing happened to me, and that's I asked the individual, the team member doing the intake, after the senior, I had sat in on a senior appointment, was that a typical appointment? And she goes, well, there are no two appointments that are alike, but for a senior citizen, this is kind of typical because they have Social Security income and their income doesn't change vastly from year to year. And typically their dwelling doesn't change. They're usually in an apartment or in a home, and that there's not a lot of changes. But she said there's a lot more changes with families with young children. And she goes, for example, I had a mother with a young child in here just last week, and the toddler, I could tell, was hungry. There was an apple on my desk, and all of the telltale signs were that that child was hungry. And so all I felt I could do at that time was offer that child the apple, because our funding source requires us to ask these set of questions and to collect these documents, and that's all that they pay us to do. But I'm the type of person, this employee was saying, and I and I processed this. I came to work for this agency because I'm the type of person who wants to do good in their community. You know,
Hmm.
I call it the Spaghetti Supper Society, right? It's the people, it's the people in the community when they find out that, someone in a household has been given a cancer diagnosis, or God forbid there's a house fire, or some tragedy has befallen some family in the community, and everybody rallies together and they'll do something like a spaghetti supper or a bean supper or some kind of a fundraiser. And as a community, we all do our part for that. Somebody has the time and is culinarily, capable of making the sauce, and other people will just buy the spaghetti for their contribution, or somebody else will make desserts, or other people will raise their hand and say, count on me to help set up the tables and chairs or help you clean up afterwards. And everybody brings their part in. Those are the kind of people who want to work for community action. Those are the kind of people who we want to work for community action. But
Good.
employees were coming into our organization and they were finding that because of all the federal regulations and the red tape, it was actually the exact opposite, because they
Hmm.
were only ever able to, buy the spaghetti, or only ever able to make the sauce. And so we needed to do things differently. And that's really when we completely, over a 7-year period, deconstructed and reconstructed the organization. And really what we said is we're going to allow form to follow function. So we started piloting things, and we started, doing rapid cycle reviews of things and trying things out, and getting to a better place where we blend and braid funding, and we do agency intake, not intake for one program. And we look at 19 different domains for families with young children, and we measure them from crisis to thriving, from everything from food and energy security to financial literacy, and also the developmental milestones of the children, from social, emotional, and academic learning across, again, 19 different domains.
That's
And then we
fabulous.
it really is, and it really paints an incredible picture, and it helps us to focus the families in charge, right?
Hmm.
Um, but then we also, and this is especially attractive to policymakers on both sides of the aisle, we measure them on on earned income vis-a-vis income from state and federal programs. And what we see over an 18-month period is that we're able to, if you look at the first 6 months, it looks like a failure because we're often taking families out of crisis by helping them access more programs to stabilize them.
Mm-hmm.
Once we get them stabilized, then we can look at things like pathways to education and employment for the parents or the caregivers in the household. And then we start to see, by 18 months, we start to see the trend lines go in the opposite direction, where there's less and less federal and state support programs and more earned income. Now, I say that, and the biggest challenge that we have is the so-called welfare cliff, where when families start to earn, they have everything pulled out from underneath them, and
I've
then
seen that with volunteers that I've worked with, and it makes no sense because it would only make sense to phase it out rather than cutting it completely. I had a volunteer years ago when I worked at American Cancer who had a couple of children from different fathers. She was very smart, and thankfully she said, I said, what would you like to do for a career? She said, eventually I'd like to learn how to help other single moms that are going through this, because I don't think that a lot of times people realize how things combine. I started a little meme. I do a lot of memes, and one says, reduce stigma, increase empathy. And that people that are dealing with homelessness, people that are dealing with substance use disorder, and people that are dealing with mental health issues are not the boogeyman. Take the time to learn their stories so you can help and not hinder, because when you talk about something like cancer, everyone agrees, every family has somebody or knows somebody that has cancer. And a lot of times people don't realize, like with alcohol, and I worked at Hope House, there's a great national campaign that said, trying drugs or alcohol is a choice. Getting addicted is not. I lost a brother 2 years ago to his alcoholism. He was about 10 years old, a half brother, very smart, left behind 5 children, 6 grandkids. The children were adults. And there just needs to be more awareness. And I am really impressed with what you're telling me about the program at ACAP and going to those other 2 counties. One of the other resources that you have up there is something we have down here. It's called Job Corps. And I was so relieved because that was a no-brainer. That helps kids that are high risk of being problems and having really big struggles in their lives, giving them an opportunity. Have you folks had a chance to work with the folks up in Limestone with that Job Corps, or is that something that's just happening because they just got rescued?
No, I mean, very closely. We work with Job Corps very closely. As you may or may not know, Job Corps and Community Action and Head Start and AmeriCorps, those are all programs that were part of Lyndon Johnson's Great Society and the War on Poverty. So the
I did
Office of
not know
Economic,
that.
yeah, so we actually on back a couple of years ago during the 60th anniversary of the signing of the Economic Opportunity Act by LBJ in the Rose Garden at the White House, we brought together the head of Job Corps, the head of a local employment agency that was representing the throwbacks in the early days of job shadowing and things like that, and brought together, it was like a dozen people and participants of these programs with Senator Angus King to have a discussion on 60 years later about the Economic Opportunity Act. And then we reenacted the photo of LBJ signing the
Oh my
Economic
goodness.
Opportunity Act with Angus King serving as LBJ sitting in front of our building. We have columns that if you blur a little bit, look a little bit like the Rose Garden columns. But we did that, and we had a really great time. But we are also, I'm very proud of the efforts of our team. We actually were the co-recipients this year of Loring Job Corps' Community Partner Award. Because when Job Corps was threatened with closure, we actually were right there using Workforce Innovation Opportunity Act dollars and working to try to place students and to get, we worked with the community college to get a CDL course up and running and have students transition into the residence halls at the community college so that they didn't have to go home because the program went dark for a period of time.
Mm-hmm.
And then personally, my son works as a career and social development counselor at Loring Job Corps, so I feel very close to that program in
That's
that way as
fantastic.
well. But we do a lot of partnership with them.
Yeah, we're coming up on a half an hour. Um, what is the best way if somebody wants to get involved with the program? In other words, maybe helping out on a board or a committee or volunteering, can they just contact ACAP to start with? And I assume that the name is still being worked on, correct?
Correct. We are currently being called or calling ourselves Community Action in Aroostook, Washington, and Hancock counties, a very long name. But we are working with a branding firm from right here in Maine. We've held a lot of interviews and surveys and the like, and we should have a new name by the end of summer.
That is absolutely fabulous. I can't tell you how much I appreciate the opportunity to talk with you. And for people who know me, these podcasts are fairly new, and to discover I have a mute button for my microphone is pretty sad. Well, thank you
Happy to
so
help
much.
you navigate that.
Thank you, Jason. We will share the link, and if you can hold on for just a minute, what I'm going to do, how this works is once I stop, it takes a minute to upload. And again, thank you. I love the county. I've been up there I don't know how many times, and people say, "Oh, it's such a long drive," and I said, "Yeah, but every time I go up, I feel like family, whether it's to Madawaska, Holton, or Presque Isle." And it's so funny when I was at the National March of Dimes meeting, like, "Oh, it's so far away." Big fat whoopee. The people are
Hard to
really
get.
nice, and instead of always having to have somebody from the county drive all the way to Augusta or Bangor or, God forbid, Portland, it makes a big difference when we can reach out. Thank
Road
you so
goes
much,
both ways.
Jason. I
Thank you.
really appreciate it.